Good day, ma'am. I am Jasmine Sedano. I will be your student nurse for today. Can I verify your full name and birthday, please?
Jeremy Sedano, November 21, 2005.
Okay. So, Ms. Jeremy, I'm here to take your vital signs, which includes your temperature, pulse rate, respiratory rate, and your blood pressure. So, the purpose of doing this assessment is to take the baseline information and to monitor of any risk for alteration in your health. So after introducing yourself to the client, make sure that you explain to her what is the purpose or why do we do this kind of procedure so that they will have a knowledge about what we're about to do with them, and make sure to clarify if they have any questions or clarifications before proceeding. So ma'am, do you have any questions?
None.
Are you comfortable right now?
Yeah.
Okay, so before we proceed, may I know what activity you did before coming in here?
I played with my dog for about 5 minutes.
And how about your food? What food did you take?
I ate a bar of chocolate earlier.
See. Do you have any history of hypertension?
None.
How about your family? Did they have any history of hypertension?
No.
Okay, so during this assessment, there will be instances like putting the thermometer on your underarm, and I will be also putting the cuff on your arm, and it will might tighten a little, but this will not cause any pain. But the tightening might be uncomfortable to you, but it will just be very quick. Is that okay?
Yeah.
Okay, so here I have prepared the equipment that we will be needing. We have hand sanitizer, thermometer, sphygmomanometer, kidney basin, which serves as our trash bin, alcohol pad, and stethoscope. So now we will start. We will start now, ma'am. I will first assess for your temperature. The first thing that we need to do is to disinfect the thermometer. So in doing this, we have to take an alcohol pad and we have to disinfect the less contaminated to most contaminated area. Okay, in a rotational manner. May I lift your sleeves, ma'am?
Yeah.
Okay. So I will be taking the patient's temperature in her axillary. The advantage of taking axillary temperature is that it is safe and non-invasive. However, the thermometer may need to be let in place in a long time to obtain an accurate measurement. So now that the timer has beeped, let me see. So your temperature, ma'am, is 35.1 degrees Celsius. So before returning the thermometer, make sure to sanitize it, to disinfect it again in a rotational manner from stem to the sensor. So we can now start assessing for the patient's heart rate and respirations. So what we're gonna do is to look for the pulse point of the patient. So in this patient, I will use the radial pulse. So place the first 2 to 3 fingers over the groove of the thumb side of the patient's inner wrist. So inner wrist, here, and count for full 1 minute. And for the respiratory rate, all you have to do is to look in the patient's chest and count every ups and downs of her chest. So ma'am, your pulse rate is 74 and your respiratory rate is 13. So we will now take her blood pressure, and to do that, we want the patient in a comfortable sitting position with their arm at heart level, at both of their feet should be flat on the floor. Okay, so it is in a heart level. So make sure that the equipment is functioning functioning properly and disinfect the stethoscopes, earpiece, diaphragm, and bell. So let me just disinfect my stethoscope. You may also want to ask the patient which arm would she prefer in taking her blood pressure. So ma'am, may I ask what arm do you prefer to take your PP?
Right arm.
So first thing we need to do is to palpate the brachial artery, which is the artery that we're gonna be listening to get our blood pressure. So because we're going to be getting our systolic number, which is the top number or the first sound we hear, and our diastolic number, where we no longer hear the sound and it is the bottom number. So now we're going to put the cuff on the patient and make sure to find the brachial artery, which is found on the bend of the arm. And then we're gonna look at our cuff, and the cuff has our arrows, which is here. So point that arrow on the brachial artery. So now we want to estimate the systolic pressure. To do that, we're going to palpate the brachial artery and inflate the cuff until I no longer feel the brachial artery. And when you no longer feel the artery, make sure to look at the gauge to know that number, because that will be our estimated systolic pressure number. Then, when I go take the blood pressure, I'm going to inflate the cuff 30 millimeters of mercury more than the estimated number. So we do that so we can avoid missing the auscultated gap. So the estimated pressure number of my patient is 110. So we are going to inflate the cuff 30 millimeters of mercury more than the estimated pressure number. So I am going to take my stethoscope and put it in my ears. Now I am going to use the bell of the stethoscope and place it over the brachial artery. Then I'm going to inflate the cuff to 140 and listen to the systolic and diastolic. So mom, your blood pressure is 107/60, which is within normal range. So remove the cuff from the patient's arm and disinfect it. So the last thing that you need to do is to record the data that you have gathered from the patient. So that is all for my return demonstration about obtaining the vital signs. Thank you for watching.